So everybody check this out. I'm about to show you a video and then have some thoughts for afterwards, but the video is from the then public health director for the state of Illinois from April of 2020, and she is explaining the federal guidelines on how to count COVID-19 deaths.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
So just for the record, nothing in healthcare, no deaths in healthcare were ever counted that way before 2020. Ever. I mean, you have to think about it logically. If we counted obesity deaths in 2020 the same way we counted COVID-19 deaths in 2020, 1.7 million people would have been registered as dying from obesity, because about 300,000 plus people a year factually die from obesity. But if we counted it the same way as we counted COVID-19 deaths, 1.7 million people, about 50% of the people that actually died that year would have been listed as dying from obesity. And that's not the case. There was people being counted dying of COVID from car accidents, that had stage 4 cancer, that were on hospice. And while I'm sure some people died from COVID, these inflated numbers make it so it's impossible to believe anything that they said. Why would the healthcare industry do this? Why would the healthcare industry just rampantly mark everybody as COVID-19? It's because they received more taxpayer money. They received money from us every time they listed somebody that died of a car accident as a COVID death. Every time they listed off a hospice patient who was given like 3 days to live and then tested positive for COVID, they were listing their death as a COVID death. It is legalized medical fraud. The government made it so that they could bribe the healthcare industry into scaring the American people. And if you can't see it that way after hearing that they counted all of those deaths as COVID deaths to inflate the numbers and skew public health policy, because that's what it does. If you make it seem vastly more deadly than what it actually is, then people are going to be more afraid. So then you're able to make them susceptible to your policies, to your takeover, basically, to your infringement upon their rights. Instead of telling them that, hey, for anybody under 70, this is a cold, we made it so everybody was terrified because everybody was dying of COVID. Literally, they counted everybody. Have a good day.